Hi, I'm Dr. Anthony Bacevice, past president of the Academy of Medicine of Cleveland in Northern Ohio. And with me today is Dr. Matthew Levy, the current president of the AMCNO. Dr. Levy, thanks for being with me this evening. Tell us a little bit about yourself. First, start telling us about your practice. What kind of medicine do you practice, Dr. Levy?
Sure. I'm an orthopedic surgeon, and I work in a community practice. I work at a couple of community hospitals. I do general orthopedics, anywhere from the very young to the very old, basic fracture care, arthroscopy, and joint replacements.
Which hospitals do you practice at?
Primarily I work at St. Vincent Charity Hospital, but I also do some work at Bedford Medical Center.
Now, Dr. Levy, what got you interested in the whole field of medicine?
Okay, so I come from a family of physicians. My father was a physician, and while I was never pushed towards medicine, certainly I saw the example that my father set, and obviously I admired him greatly, and that's what first got me involved and interested. And then as I moved through, I found that for me it was going to be the decision between medicine and surgery. And then I decided surgery was the way to go. It seemed to be the more fun thing for me. And I found that orthopedics suited me, and I pursued that.
What are some of your accomplishments? What would you say are some of the things that you're most proud of about your career so far?
Well, coming from a community practice, I've not really done a lot of research. I've not really done a lot of academics, but I'm very proud of the way that I've treated my patients. Sometimes I think I treat my patients better than I treat my family. I'm very accessible. I like to think I'm pretty reliable, and through hard work, I've built what I like to think is a pretty successful practice.
We all sometimes tend to give our families the second rung on the ladder, and that sort of comes with the territory of practicing medicine. You obviously must have a very dedicated family. Tell us about them a little bit.
Okay, I have a wife. I've been married for 20 plus years, and she's been through my side for thick and thin. We met when I was in medical school, and so she's seen me all the way through training and that. And she's not in medicine. And then I have 3 children. My oldest is 21 years old. He has absolutely zero interest in medicine.
I see.
My next one is 18. He's going to be entering college this fall, and he seems like he might be interested in medicine.
Well, that's great.
And then our baby is 11 years old.
Fabulous. Now, as president of the Academy of Medicine in Cleveland and Northern Ohio, Dr. Levy, what are some of your goals for this year that you're going to spend as our president?
Well, I hope to continue to do the work that our previous presidents have done. It's not glamorous, it's not out there, but I think we've really made an impact in terms of bills being brought to the legislature, of helping our members navigate through electronic health records. We were at the forefront last year with the Ebola crisis. So I mean, we do a lot of things, and I think what we do is behind the scenes. We keep our members' practices running more smoothly, and we advocate for them, and while they may not realize it, I think we're helping them get over some of their practice hurdles.
What are a couple of your big concerns about the future of medicine?
Obviously there's a lot, but I think what it all comes down, I think if I could put it all together, I just think that physician autonomy is being eroded. I think that a lot of the decisions that affect patient care are being made by non-physicians. I think a lot of what is happening in medicine is not towards patient care, but more for saving money. And I think that's not the right way to take medicine.
That's a big concern of all of ours. But I wish you well in your leadership that we have over the coming year. I think the Academy of Medicine, as you pointed out, is a group that advocates for how we physicians practice medicine. I look forward to some of the things that you're going to get accomplished for us, and thanks very much for the time that you spent with us today to get to know a little bit more about our president, Dr. Levy.
Thank you very much. Thank you.